More than 194 million diabetics are suffering worldwide, and this would grow to about 366 million by 2030. Do you know, somewhere in the world, a leg is lost to diabetes every 30 seconds? Diabetes mellitus is a 21st century killer. 3 million people have died of diabetes in year 2000, making it the world's number 5 cause of death. What do you know about diabetes mellitus? Every time we eat, the food is digested and converted into sugar, which our body uses for energy. Persons with diabetes are impaired in the ability to metabolize glucose. The name diabetes mellitus refers to symptoms that include increase in urinary volume, frequency of urination, thirst, itching, hunger, weight loss and weakness. Diabetic patients rely on oral anti-diabetic drugs, mostly made from chemical compounds. Some natural herbal-based and insulin injections are used to regulate their blood glucose levels. However, diabetes is a form of disease that need not kill, and certainly patients do not need to lose a toe or leg. Diabetes is ranked among the leading causes of blindness, renal failure, and lower limb amputation. Diabetes disease should not be taken lightly. It is now one of the leading causes of death through its effects on cardiovascular disease. 70 to 80% of people with diabetes die of cardiovascular disease. Diabetes complications lead to human suffering and disability. The World Health Organization reports that type 2 diabetes constitutes about 85% to 95% of all diabetes in developed countries, and accounts for an even higher percentage in developing countries. Diabetes mellitus is now a common and serious global health problem. This disease wreaks more than just physical harm and deterioration. About half of all the money spent on diabetes care goes towards the costs of managing diabetic complications. Total direct health care expenditure on diabetes worldwide will be between 213 billion US dollars and 396 billion US dollars in 2025, which represents approximately 7 to 13% of the world's healthcare budget. Have you wondered how safe your diabetic condition is? Is your diabetes out of control? Insulin's role in the body is to trigger cells to take up the carbohydrate glucose so that our cells can use this energy-yielding sugar. The goal is to regulate your blood glucose level to as close to normal as possible and to achieve and maintain an ideal weight.